Grey's Anatomy Season 22, Episode 10 is a mix of emotional reunions, difficult medical decisions, and the personal struggles that have consistently defined the show's long-term success. Following weeks of build-up following the dramatic events of the first half of the season, this episode brings together several major themes, from caring for patients under stress to the return of beloved characters, all with a foundation of drama built on hope and heartbreak. One of the most anticipated elements of Strip That Down is the return of Dr. Addison Montgomery. His presence instantly changes the emotional tone of Grey Sloan Memorial. Addison's appearance is more than just a nostalgic ghost. It's a powerful narrative catalyst that brings old wounds and unresolved tensions to the surface. She enlists the help of Dr. Amelia Shepard, who pulls her out of sabbatical and assigns her to an important operation on a pregnant woman with a dangerous brain tumor. Their dynamic, born of years of shared history and mutual respect, provides some of the episode's most powerful scenes, reminding fans why their connection remains fascinating. Addison's story quickly takes a very personal turn when she confides in Amelia that her marriage to Jake Riley is falling apart due to the pressures of her career and the strain of working with underserved patients. The confession, made while preparing for surgery, highlights a harsh reality faced by many of the show's doctors: the struggle to balance life-saving work with personal well-being and relationships. Her vulnerability is raw and moving, and shows how the series continues to blend medical drama with intimate character storytelling. This episode's medical incident balances seriousness with the series' signature ensemble interplay. Bailey, Owen, and other treating physicians face both the logistical and emotional challenges of caring for patients. One particularly poignant story concerns a patient participating in a clinical trial whose promising results were abruptly interrupted by budget cuts, suddenly giving way to hope and misery. This scenario not only reflects frustrations with the limitations of modern medicine, but also real-world issues related to healthcare access and systemic issues. Light but thoughtful, the episode is laced with scenes that combine physical humor and character development, such as an injured stripper being brought in on a baby oil slip and needing hip treatment in the operating room. These moments, while comical on the surface, provide an opportunity for characters like Link and Simone to show how far they've come professionally and emotionally, even as they continue to recover from past traumas and injuries. Link's return to surgery has special meaning. After being injured in the previous episode, his first day back on the field highlighted the physical and mental obstacles he must overcome. The scene in which Simone helps with the surgery highlights the development of mentorship and partnership among the hospital's new generation of doctors. Personal relationships also take center stage outside the operating room. Joe finally comes out to his twins, a moment of true relief and joy. But even among these lighter beats, the series doesn't shy away from emotional complexity, depicting her nervousness about returning home and adjusting to family life, reminding us that happiness in this world is never simple. The episodes are well-paced, creating a rich tapestry of stories that range from growth and reconciliation to disappointment and heartbreak without ever feeling underdeveloped. Transitions between intensive treatment scenes and deeply personal conversations give Strip That Down a rhythm that reflects life in a large hospital. It's chaotic, unpredictable, and full of moments that go from comical to tragic in a matter of seconds. Perhaps more importantly, this episode reinforces Grey's Anatomy's core strength: its ability to revisit old characters in ways that feel meaningful and earned, rather than gimmicky. Addison's return is not nostalgia per se. It helps highlight current themes of sacrifice, ambition, and the emotional cost of life in medicine. Overall, Season 22, Episode 10 stands out as a character-driven chapter that combines multiple storylines with emotional intelligence and narrative accuracy. It provides important callbacks and developments for longtime viewers while advancing the broader storyline of this season. Whether it's moments of patient perseverance, heartfelt reunions, or quiet acknowledgments of personal struggles, this episode shows why Grey's Anatomy continues to resonate with viewers more than 20